I'm Kangarlu. I'm a physicist. I have been trained with imaging technologies, specifically MRI, magnetic resonance imaging, and I've been working on a very special type of MRI called functional magnetic resonance imaging, or FMRI, that uses very sophisticated technique with magnetic field to acquire images from the human brain, showing actually the blood flow to different brain regions. And that's an extremely powerful technology that can allow us to see what part of the brain is active. And then we can develop some kind of a pattern of activity, how different brain regions talk to each other. And as a result, we can acquire what we call a healthy or a normal brain function or a normal mind. And then this way we can actually use this technology with people with psychiatric disorders and basically apply the same technology to those people and construct their blood flow maps or functional activity maps. And then in comparison with the maps of normal people, we can find out exactly what part of the brain is not doing its job. And then through another sophisticated technology called transcranial magnetic stimulation, or TMS, we can deliver magnetic pulses, which cause magnetic pulses to use electrical stimulation to brain regions. And since the brain is really a large electrical factory, we can actually adjust the part of the brain that's not doing its job. And this brings a lot of relief to people with psychiatric disorders.
I'm Moreno. I'm a clinical neuroscientist, and I've devoted my career to the studying of the brain and bringing new technologies for the treatment of neuropsychiatric disorders. And in doing so, we have developed this combination of technologies with the functional MRI, functional magnetic resonance imaging. That is a technology that allows us to detect the activity of the brain at a very high spatial resolution. Mechanically speaking, the millimeter level, we're going to be able to detect the signal and reconstruct the networks of the brain. Network is a group of interconnected regions, so we are going to reconstruct the networks of the patient's brain. We compare, as Dr. Kangarlu was saying, those networks with healthy brains matching age and sex, and through those comparisons we isolate the specific circuits of the brain that are malfunctioning. So the functional MRI is a diagnostic tool that sometimes allows us to clarify diagnosis, and also is used to develop the treatment plan, which circuits of the brain are malfunctioning and which areas of the brain needs treatment, so that we can then, with the second technology, the transcranial magnetic stimulation, which is a non-invasive, non-pharmacological brain stimulation technique, we can go to those exact locations that the imaging is showing as faulty and stimulate those regions to repair the pattern of activity and connectivity. And this comes with an improvement in the symptoms that the patient is expressing.